Hi, I'm Dr. Masica Jordan. I'm the president and CEO of Jordan Peer Recovery, as well as the CEO for Peerfinity. I'm also a professor at Bowie State University, teaching in the counseling psychology program. I train master's level students, and we specialize and we train them to have a specialization in Adlerian psychology. I teach lifestyle assessment, Adlerian lifestyle assessment, as well as other Adlerian courses and Adlerian training. In addition to those training modules, I also, in courses, of course, I also am the student advisor, co-advisor for the Student Adlerian Society, where we hold a yearly conference, an Adlerian conference at Bowie State University. In addition to that, I'm also a board member for MAPS, which is the Mid-Atlantic area.
Hi everyone, my name is Stephanie Strianse. I serve as the Director of Operations for Jordan Peer Recovery and the COO for Peerfinity. My background is in psychology. I hold a master's in forensic psychology. I am a human services board certified practitioner. I am a national peer recovery support specialist and a registered peer supervisor.
Together, Stephanie and I are excited to present to you during this year's conference, The Color of Change in Crisis. This is the ACTS model for culturally responsive peer recovery services. We will be presenting this interactive presentation. Yes, I said interactive. You're going to have to interact with us. Even though it's a virtual presentation, we're going to make sure that no one is bored, everyone is focused, and everyone is learning hands-on, auditorily and visually. You're going to have so many fun activities. You're going to get to know the other group members, and it's true to that learning process of that social connections. We're going to focus on the process of delivering culturally responsive support and counseling services. This is major, especially during a time where the APA president says that we're in a national crisis, a racism pandemic is what she calls it. The Jordan Peer Recovery's ACTS model will be introduced through a series of activities where participants are asked to look internally at their own biases in order to increase cultural responsiveness in service delivery. This is going to be a very interactive presentation. Participants will be able to understand and practice using JPR's ACTS model for culturally responsive services in their personal and professional lives. This is a model that we have used in several places where people are doing counseling and mental health services, as well as peer support and community-based services throughout the United States. This model has been used in places like Johns Hopkins Baby Medical Center, where we have peers that are using the model. This model has been used in University of Maryland. This model has been used in several places where we are training people to be culturally responsive. Participants will also be able to review the social determinants of health and the connections with the 8 societal systems of influence. And also participants will be able to address and discuss the effects of the current racism pandemic occurring simultaneously with the opioid epidemic and the COVID-19 pandemic. You're going to walk away more culturally responsive and being able to meet clients where they are.
We look forward to seeing you at the conference.